Now, on this International Women's Day, the global community is calling to press for progress. According to the United Nations, significant strides have been made in increasing life expectancy and reducing some of the common killers associated with child and maternal mortality. However, women and girls, especially in developing countries, remain the most vulnerable to diseases like HIV/AIDS or maternal mortality. According to the World Health Organization, about 650 million people in the world live with disabilities and frequently encounter a myriad of physical and social obstacles. Activists say as the world aims to push for progress, people need to ensure that women and girls with disabilities in low and middle income countries have better access to healthcare services and they are not left behind in health systems and policies. Joining us now for more on the subject is Tausi Suedi, founder and CEO of Childbirth Survival International, a global humanitarian grassroots organization dedicated to, among other things, improving the quality, access and delivery of health services and information for pregnant women, children and youth in marginalized communities in Baltimore and abroad. Tausi Suedi, welcome to the show.
Thank you. Great to be here.
So as we talk about women's rights and women's life improving, there is a group that seems to be left behind or forgotten at times, women with disability. They face particular challenges specific to the conditions. Can you tell us a little more about that?
That's absolutely correct. Women with disabilities, women and girls with disabilities are often marginalized and discriminated. And in a lot of these developing countries or underserved communities where being a woman or a girl is already a hindering factor for them to access services in health or even education, adding a disability only doubles that discrimination that they face. And you find that a lot of them, they're hindered by, depending on what the disability is, because they're from mild to severe. And a lot of them,
to physical.
Absolutely,
yes.
And mental to physical and to all the way to sensory. So it's understanding that, press for progress is definitely the time to make sure that women and girls with disabilities are not left behind as we continue to push mainstream programs.
So when you talk about programs, what type of programs are we talking about to make sure that they are part of the system?
So especially when it comes to health, we're talking about inclusive public health programs. If you look at the global health landscape, a lot of the programs that are designed, they do not really include women with disabilities. So for instance, you find, you might set up a camp for cervical cancer screening, which CSI recently did in Uganda. And where it's set up, women are not able to get there due to transportation, due to cost, and also understanding that a lot of the people and women with disabilities live in rural areas. So that in itself, adds more challenges in terms of how they're able to move from the rural area to the urban area in order to get services, or even finding services in their rural communities.
And even something as abuse and protecting them, that's really critical as well.
Absolutely. Women, there's so many reports out there based on, World Health Organization and other UN reports. Women with disabilities are 10 times more likely to be abused or, violated, and that increases their, vulnerability to, issues like HIV/AIDS and other societal issues that tend to happen. And when women with disabilities are not able to advocate for themselves, they're not able to access support services, you find that only increases their level of hardship in their communities.
Looking at policies, what do you see are some of the policies that perhaps have been agreed on, need to be implemented, or should be looked into?
I think the United Nations Convention on the Rights of Persons with Disabilities is a great framework for countries and also nonprofit organizations that are working in the health sector and various other sectors, for example, employment and skills building and education. It creates that framework of how to incorporate and include programs that are able to reach the unreached, and especially women with disabilities. So, having better policies that, number one, increase research so that there's data to be able to figure out where are these people and how can we best reach them in order to increase the, access to services and education and health.
So moving forward, one thing I have admired when I came to the United States and also in other parts of the Western world is the fact that even something as simple as handicap parking you know, they have it here, but you go to our countries in Africa, you don't see anything like that. So moving forward, what do you think that some basic steps that sub-Saharan African can take to help?
Some basic steps. Number one, community education. Starting with the household, with the local leaders, with the, with government leaders, because there's a lot of stigma associated with disabilities. And you find, a lot of families that have, disabled people, they hide them. And so that in itself doesn't help in terms of reaching them. So a lot of community sensitization is needed, and also the will to be able to design inclusive programs. Again, going back to public health programs, designing programs that definitely increase universal access to health services and also other opportunities for women with disabilities.
Tausi Suedi, thank you so much for joining us today. And that was Tausi Suedi. She is founder and CEO of Childbirth Survival International and an adjunct professor at Towson University for Public Health.